Welcome, ladies and gentlemen. I hope you're doing awesome. Today I'm going to be talking about what's the hardest thing about being a nurse. Let's get started. Okay, I'm a fourth year nursing student. I've been 4 years in nursing university. I'm pretty much a nurse now. Okay, all my friends are nurses. You name it. Now, what's the hardest thing about nursing? If you want me to be fast, it's just stressful, isn't it? So let me explain. So there's two parts. I'm gonna make the student university life, and I'm gonna make the nursing professional life. University is fucking brutal and harder than what people think. Because not only you need to understand a lot of shit, like the anatomy from I don't want to go through all of that, but there's a lot of modules. You can understand the entire bodies, the entire diseases, the entire specialties, everything, But it's also harsh. In my case, I had to do 8 hours every single day. Also, I had to do 1,200 hours of internship, and also pretty much I had to do 8 hours every single day, so there is no days off. There is weekends sometimes, but you know what I'm saying. It's a lot. I'll say about the professional life, however, probably the hardest thing is just really just going through it and getting adapted to the situation you're in. Because, let me explain. At first, when you work, you're probably in a place that you've never heard of, or maybe if you're lucky, you've heard of it, and it's pretty close to your city. Now, if it's not, then it's a challenge of itself. Because not only you gotta do what you gotta do as a nurse, but also you gotta adapt to the situationship and living and the area. Maybe they don't speak the language that you speak or the dialect you speak. Maybe it's a little bit different. Maybe the culture is a bit different. So you gotta used to that as well. Maybe you're alone. Maybe you are with a team. Who are the teams? Who are this? What are the times? Everything. And obviously there's other hardships. As an example, it depends from what system you're in or you apply to as a nurse. If we're talking about some hospitals, it can be night shifts. You can have night shifts, which is pretty hard, especially if you are in the emergency rooms. Trust me, it's fucking brutal. And obviously, you have some other places, which is we're talking about rural villages, which you might take a lot of responsibility on your own. So there's a little bit of a sweet balance in here. Both of them are hard, it's just different types of hard. Now, let me put another layer and let's talk about something that everyone understands in a way. All nurses go through some shit, right? And there's a reason why, as an example, in Canada, there is a fucking there is a psychologist in every hospital for nurses and the paramedic staff as well as doctors as well that basically do the medical visit, the medical check, and also if you're feeling unwell, etc., you gotta go to the psychologist. There's not only that, but the reason why you have high risks of psychology, whatever, blah blah blah, because one, you're dealing with diseases all day, and some people don't deal with that a lot because there is something that called, I don't remember the exact term, but it's like transformation or transmission in psychology, which is if I'm feeling unwell, I might as well making you feel unwell just by talking to you. So a lot of the times you're talking with patients, obviously your role is to make them feel better, you can get fucked basically by just being as well, not feeling great, not having, an optimism, not really optimism, but just, being productive and stuff like that. So you have to find that sweet professional spot where you do your duties, and obviously you gotta comfort the patients and do your job, but as well as don't fuck yourself and don't be sick yourself. There's the other aspect as well, which is responsibility of people's life. Obviously, you have to be careful that you apply whatever you read and whatever you studied in university, and there's a lot of stuff. And obviously, there's different drugs, different prescriptions. There's different people, different ways, different. And sometimes the materials are not enough, or there's different materials. You gotta get used to it, gotta adapt. Sometimes you gotta ask people, etc. So there's also that responsibility that comes with it. there's the risk, because obviously it's drugs, and we're talking about, it's a very vast, big domain of studies. We're talking about pharmacology, basically. If you're not familiar with the world, pharmacology, well, it's a little bit obvious if you have higher degrees, but it's the science that studies, drugs, basically. That's like the most basic way. Drugs, their interactions with the human body, the trajectory in the human body, how they affect the human body, and everything basically. Are they effective with the diseases? What are the side effects, indications, etc.? You name it, that's basically the science. Now, let's talk about something else. I would say, and this is coming from personal experience, you can find as a nurse different school of studies. So, not only that, like the schools, like university, so there's university and there's schools of nursing. So, schools of nursing are way different than the university. Obviously, university is more trusted by the government, and it's basically the government program, and it's higher, there. But there's also the schools programs, which is cool, but not as good. And sometimes you find a little bit of differences when you're in the train. You're like, well, that guy is probably should do a little bit different. But this is not professionally, because the schools can't really work as nurses. They work as something else. So you got the point. This is more of the student perspective. Now, let me explain more. I'll say that some of the hardest things as well is, as for me, I have the option or the branch of nursing, which is multitasking or multidisciplinary nurse, which means I'm not only doing anesthesia or emergency nurse, I'm doing, basically I can do all of them. I can be in any one of them. Basically, I work at a hospital, I can be in the emergency, I can be in the block like the operation room, I can be in the ER emergency, I can be in any services, really like any of them, etc. You name it, you got the point. So a lot of the stuff, basically, when you start working with hospitals, you go through the services, like different services in different times, and obviously it takes more time to adapt to the service. It takes a little bit of time, so you get used to the staff, the time, the drugs that get used to it, because there's certain drugs that are very common in certain services, and that's like the main task. Like, you have to understand, okay, these are the drugs, these are the prescriptions that are the most common, So basically make it easier for you in the future, and not all the time you start thinking about what you gotta do exactly, but you put some work in and got used to it. Now the problem with changing services is that you gotta go through that process again and again. So it's a little bit of headache. Luckily, usually, it's only for the first few years, then you sort of a little bit become stable a little bit, then maybe you change, but that is usually voluntary, so you ask to change, but not really. Sometimes you just change, which is good and bad, right? Because every time you gotta ask and you gotta get adapted to the staff, ain't just life, innit? Okay, let me talk about the good things about being a nurse. Why not? Okay? I'd say the good thing, one, is the respect you get from patients. Patients really respect you, especially if they know you're a governmental nurse, like a government certified nurse, so you have a very good education, you're well educated, you've been through a lot to actually be in that position. And I actually have awesome conversations. Even like 2 days ago, we were with a patient, and it was an awesome experience, She was talking about whatever, and she was really, she was really glad and grateful that we were with her and helping her and stuff like that, which I think is pretty awesome to have as a nurse. Second thing that is pretty good is the social stature of the nurse. It's very well respected, very well known. Everybody knows it, everybody respects it, and I think it's a very honorable work. And this is actually was one of the quotes. So Northern Morocco, I was traveling there, I met Doctor. She had this six-pack, she was ripped, she was beautiful, yeah? We were playing volleyball, at the end we were talking, I said, well, I'm actually a nurse from fourth year nursing college, university. And she said, well, it's actually very honorable work. And she's a doctor as well. It's a lot of honor in being a nurse. Yeah, I think these are like very big advantages or very good stuff about being a nurse. So I don't make this video just very negative. So if you like this video and you want more videos like this, there's hundreds, and I will make hundreds as well. Just let me know in the comments. Subscribe, please.